All right. So Dr. Lindsey Fell was born in Colorado, learned to love the outdoors at an early age. After graduating college in 2010, she worked summers teaching outdoor skills and wilderness medicine for the National Outdoor Leadership School, which sounds like a lot of fun. Winters were sent as a ski patroller, EMT, and then as an avalanche forecaster in the Tetons. A few too close experiences with lightning were enough to perk her interest in the subject. So we're excited about that, to have somebody who's had those close calls and can help teach us on this level. She went to the 4 years in medical school in Portland, Oregon, and is now, like I said, a resident in emergency medicine at the University of Utah Health. And if I remember, you're part of their wilderness medicine track as well, Lindsey?
Yeah, correct.
Perfect. Okay, I am going to stop my share and turn it over to you, Lindsey.
All right. First of all, everybody, thank you so much for coming today. I'll just switch over to the PowerPoint. Okay, can everybody see that okay?
Yes.
Okay, wonderful. Turn off captions here. Okay, so yeah, we're going to be talking about lightning today, a very fascinating subject. All right, here's a little overview. We're going to talk about the history, just basic understanding of how lightning works, where lightning happens and why it happens, different types of lightning strikes, kind of injuries we're most concerned about, treatment, prevention, and then we'll do a little bit of myth busting at the end. All right, definition: discharge of electrical energy in the air. Pretty straightforward here, but I think it just kind of sets a nice image in our mind of what we're thinking about. A little bit of history, which I think is fascinating, is just that lightning's, it's caused fascination in humankind for forever. The Greeks had Zeus, and this was a more ominous meaning of lightning, but apparently it was a warning tool, and that it was a direct sign of his presence. And so any spot where lightning struck was sacred. The Romans believed in Jupiter, and Jupiter used it as a tool of vengeance. And those who were struck by lightning were actually denied burial rights. The Navajo had the lightning twins, and they had the idea that lightning could strike straight or it could strike crooked, and that it killed mythic beasts that plagued people. So a little more positive view. The Bantu tribe in India, or in Africa, believed in Impundulo, which is pretty cool. He was the bird god who would flap wings and create thunder, and that lightning had a healing power. And a lot of other beliefs as well, but just kind of an interesting background about how we've valued lightning over the years. Okay, and here's a picture of Impundulo from Africa. All right, so how does lightning work? First of all, what we need, if we're thinking about a basic recipe here, is a bunch of warm, moist air. And this warm, moist air is going to be existing usually over a large body of water. And then what you need is an updraft. So warm, moist air that's typically been over an ocean, and it meets land, and then it causes this warm, moist air and these water particles to rise and create a cumulonimbus cloud or thundercloud. And then in this cloud, as the particles, the ice particles, just kind of mix and stir about with the winds, the charge actually separates so that the negative charges go on the bottom of the cloud most typically, and then the positive charges go on top of the cloud. And those negative charges on the bottom of the cloud start to get attracted to the earth because the earth is positively charged. And if we think about it, opposite charges attract like a magnet. So that's essentially what lightning is trying to do. It's trying to connect those negative charges in the cloud with the positive charges on the ground. And so what it will do is the cloud will let out what are called leaders, and they're negative charges that kind of go out a little bit, investigate, and come back into the cloud. And they go about by 50-meter increments, and they'll just work their way closer and closer to that positive charge on the ground. And the ground has positive charge, and they have what are called upward streamers, and the positive charge from the ground comes up and tries to meet. So we have a couple pictures here. Here's the first picture where we'll talk about, this warm positive updraft, the separation of charge that then causes basically the charges to want to meet. And here's another picture. So the positive charge on the ground, the negative charge on the cloud, and then these leaders, those negative charges kind of barely just kind of coming down towards the ground, And the positive charges, the streamers going up, and eventually they meet. And when we have cloud to ground lightning, this is what we have in picture 3 here. So where does lightning happen? I was kind of surprised to learn that the most common place is sub-Saharan Africa. But if we think about what we need, which we need a bunch of warm, moist air, and then we need a little bit of that uplift, so that land, this sub-Saharan African region is actually quite mountainous. It stays warm all the time, and then it has all the warm water from the ocean to come in and create that the clouds. So that's actually the most common place. In the US, we have about 40 deaths per year. Florida is the most common because the Gulf has a bunch of warm water. And even though we don't really think of Florida as mountainous, it is enough of an uplift from sea to land to create that cloud. Most common time is May through September. Men are more often struck than women. And noon to 6 p.m. is the most common time. So you get that afternoon when the day's kind of warmed up. Looking at the US closer here, you can see this pulse density map. So this just takes the square area of land and divides it. That way you can like more accurately determine like where the density of strikes are. So you can see here down in Florida that it really has the highest density of strikes. And as you move north and west from Florida, the strikes decrease. Looking at Utah, we have about 1.9 million lightning pulses per year. So that includes what we call cloud to cloud lightning and then cloud to ground lightning. And if you look at the bottom here, about 103,000 cloud to ground lightning strikes per year. Just for a little more interest, it looks like San Juan County has the highest number of strikes, followed closely by Box Elder and Uinta counties. I don't see Salt Lake on the list, so a little reassuring for us here in town. All right, so we'll get into types of strikes. And basically, how can we get injured from lightning? So we typically think of lightning as, oh, I was struck by lightning, and that's what's called a direct strike. Those are actually the least common strikes that happen. There's contact strikes, and we'll get into with pictures, a little more description of these in a second. There's side flash, or also called side splash strikes, ground current, upward streamers, and then not electrical, but we can get injured also from blunt or barotrauma, basically the concussive force that happens when lightning strikes. So here's a direct strike, very basic picture, but I think it does the job. Someone is struck by lightning. They say about 3 to 5% of lightning strikes are direct strikes. They're not always fatal, but these are typically some of the more serious ones. And we'll get into specific injuries in a little bit. I also forgot to mention, if anyone has any questions at any point, feel free to just chime in and we can take a pause. There'll also be time for questions at the end. And here's contact strikes. This is one that's less common now, especially in developed worlds or societies than it used to be. But this happens when things like plumbing and hardwired telephones, if lightning strikes the building or the ground outside, it can travel through something that's not grounded, like the plumbing, and the electricity can travel through into you. So it's important to, tell people when you're talking about safety to stay away from plumbing, especially if you know it's not grounded. And then hardwired telephones in particular, which are less and less common these days. One thing that's also interesting too is if you're ever in like an old rec center, I remember I did some training up at Montana State, and their rec center, the pool wasn't grounded. So even though you were indoors in a building, you weren't allowed to be in the pool during a lightning storm. So just something to keep in mind. The next type of strike is called a side flash or a side splash. And this is what happens, and this is why you don't want to stand next to tall trees or other objects when lightning's around, because lightning can strike that tree, and typically it's trying to go to the ground, like we talked about, where that positive charge is. But sometimes, if the tree has more resistance than us, that electrical current is trying to find the path of least resistance. So sometimes it'll actually jump from the tree and arc over to the person and go down to the ground that way. So that's one way you can be struck. And they say that an area about 50 meters around is not safe. So it really is quite a distance that it can do this. Next is ground current. This is actually the most common type of strike. And this is what happens when lightning strikes the ground and it's traveling through the ground, and the amount of electricity, its charge, decreases as you move out from the place of the strike. But if it reaches something like a person or something else with least resistance, it might actually go up through it on its way to continuing on traveling to the ground. So also you want to stay, I mean, they say about a zone within 50 meters, you can get a ground current strike. So just be aware that this is something that can happen, and you can be struck through the ground. Next way you can be struck is an upward streamer. So we talked about these upward streamers, the positive charge that comes from the earth. Well, a person can actually become part of that positive charge as the negative charge is coming down. And I've personally experienced this. I'm not sure if anyone else has. It's a little bit disconcerting, but if you've ever been really close to a pretty big electrical storm, you can actually have your hair stand on end. And this is what's happening. That positive charge is trying to connect with the negative charge from the cloud. So just a heads up, if you ever have something like this, or if you're kind of seeing sparks on metal things or just feeling like kind of like hearing this electricity, those are those upward streamers trying to connect with the negative charge from the cloud. And the last type, which is not electrical, but does happen with lightning, is blunt or barotrauma. And basically you can picture similar to being close to like an explosion from a bomb. You can just experience concussive force injuries. So being thrown distances, and then eardrum rupture, which we'll also get into later. But just force, similar to what you'd experience when you're next to a blast. So blast injuries. All right, and so moving on to specific injuries. We can have cardiac involvement, pulmonary involvement, neurological involvement, skin, ears, eyes, psychological involvement, endocrine abnormalities, and then we'll talk about issues with pregnancy and then blunt trauma. First, we'll talk about mechanics. So how does lighting injure us? So we're talking about current, and current is a flow of electrons. The resistance is how much that current flow is impeded, and the degree to which it's impeded is what generates heat. So when we talk about lighting injuries, the amount of heat that's generated is a product of basically how much current or how much electricity is flowing through, and how much time that electricity has spent flowing through that particular thing. So in our bodies, lighting is going to follow the path of least resistance, and nerves have the least resistance, and then blood, muscle, skin, fat, and bone. So lighting tends to affect the nerves first, then the blood, then the muscle, then the skin, fat, and bone. So we think of lighting as primarily actually a neurological issue, and we'll get into that in a second. And let's just talk real quick about electricity versus lightning. So home electricity functions in AC and DC, and lightning is this unidirectional, massive, just crap ton of electricity that hits us all at one instant. Here's a chart on the next page. So what this means for us is that lightning spends relatively little time in our body when it hits, whereas like high voltage electricity happens at a much lower energy and also spends a lot more time in our body. So lightning is usually what we call flashover. It might like hit all of our internal things really, really quickly, and then it mostly flashes over our skin. Whereas high voltage electricity leads to these deep internal burns. So when someone comes to the emergency department or calls EMS or 911 with a high voltage like home electricity burn, we're thinking about, getting rhabdomyolysis or just deep muscular burns and dealing with the effects from that. What we're dealing with lightning is more of a neurological issue, and it picture like similar to what we use when we use a defibrillator, is just a massive form of electricity. So it can cause these cardiac abnormalities and neurological issues. So that's kind of what we're thinking about here with lightning. So when we deal with cardiac issues in lightning, picture is like if we were to give someone a shock at the wrong time, we could send their heart into a weird rhythm. And that's exactly what's going on with lightning. So if someone's down and their heart's not working, it could be that their heart was thrown out of rhythm. So the treatment for that is going to be CPR and defibrillation as soon as we can get it. And in the meantime, making sure we provide good ventilations. And we'll review all this in a little bit as well. Next, we'll think about pulmonary issues. So we can often get pulmonary edema or fluid buildup in the lungs because the heart has been thrown out of whack. So we're thinking about cardiac issues that are maybe causing some heart issues. We could be also dealing with lung bruises or bleeding from trauma from being flung somewhere. And we also want to think about pneumomediastinum, or air between like the chest, that's not in the lungs, but it's in the chest cavity as well. And then in neurological issues. So we call lightning a primarily neurologic issue because it's most likely to run through our nerves. We put it into 3 boxes: immediate and transient, immediate and prolonged, or delayed effects. So the immediate and transient has some interesting ones. Coronoparalysis is the first one. Korono in Greek means lightning, and then paralysis. And it's this odd transient paralysis you get, mainly of your lower extremities. It lasts about 3 to 4 hours. There was an incident in North Carolina last year that I was present for, where 6 people were flung, and 3 of the 6 had coronoparalysis, where they actually described not being able to move their legs for about an hour and wanting to like run, get away, or go for help, and they couldn't move their legs. And then it was restored without issue. Dysesthesias, or just kind of like numbness, tingling, weird nerve pain in your extremities, is another immediate but usually transient issue. Loss of consciousness and seizures. More prolonged things we think about are usually effects of trauma from being flung. So brain bleeds, issues with the spinal cord. Sometimes people can have balance issues that can last for a while. And then just they can forget the events leading up to it, and then just prolonged headaches. The delayed issues are actually under controversy right now, but people used to think that you could get ALS or Parkinson's disease from lightning, and they're not really so sure how closely that's correlated. But I put that in there just as like, well, this used to be the case, but usually not as much anymore. And then talking about skin issues, seeing like entry and exit burns from lightning are actually pretty uncommon. But some other things you can find are linear burns from where like water was on people's skins, usually down the small of their back, or where they had sweat, or if it was raining at the time. They can get burns from where that water was on their skin. They can get little punctate burns sometimes, especially in their feet, where like a lot of charge exited their feet. Full thickness burns. An interesting thing we'll talk about called Lichtenberg flowers, or ferning, which are very temporary but very interesting, and they're actually pathognomonic for lightning, meaning that if you see these, it was definitely that person was hit by lightning. And then thermal burns from when they had metal on them, and then it burned their skin. So here's a couple of photos. This first one is pretty interesting. This is called flash moisture vaporization. And you've probably heard the term like, oh, knocked your socks off. And that's actually a term from where like if people had like water pooling in their shoes, it's this explosive vaporization of superheated water. And that's what can happen. It's pretty wild. And so if you see something like that, you can kind of guess that someone was hit by lightning. And then these next ones are just like, you can see this ripping and tearing of clothes. So let's say someone was found down in the wilderness and their clothes are all ripped and their shoes are blown off. Like, yeah, foul play could be a possibility. We always want to consider that, but also consider lightning. Even if their clothes just look torn and weird, like lightning can do that. And then you can see in these person's shoes, this is from actually a farm worker, these punctate burns out on like on the sole of their shoes there, and how their hat's all ripped. That's all from lightning. Here's the contact burns where someone was wearing a metal necklace on their skin. And then here you can see what I think is really fascinating called Lichtenberg ferning, or Lichtenberg flowers. But it's these temporary marks that lightning will leave, and they only last for a few hours. But this is, like I said, only lightning can do this. So this can, definitely confirm that someone was struck by lightning. I always say that if this happened to me and I survived, I would want to run to the tattoo shop as quick as I could and get it put on, because it's pretty cool. And here's just another shot of maybe someone got a tattoo of it. All right, and then talking about injuries to our ears. So about 30 to 50% of folks who are struck by lightning actually get an eardrum rupture, pretty serious. People can also just have prolonged ringing in their ears, balance issues, and then less common is permanent deafness, usually from like the blast injury, CSF leak, or just this temporary like ear drainage. And here's another picture of an eardrum rupture. Looks pretty painful. All right, and then talking about injuries to the eyes. Lots of things, basically anything can happen to the eyes. I would say most common are cataracts, but people can have corneal lesions, vitreal hemorrhages, any kind of retinal detachment, and then also expect some autonomic disturbances. So if you see someone, it's called Horner's syndrome, with basically, a contracted pupil, a drooping eyelid, and decreased sweating on one side, that can also happen from lightning. And then just weird or decreased pupillary reflexes as well. Here's a picture of a cataract from a lightning injury. And then endocrine abnormalities are actually kind of interesting. People can have salt wasting, decreased libido, and actually menstrual irregularities are quite common as well from lightning injuries. And then in pregnancy, there's 11 case reports that I've found. 5 have made it to full-term live births with no compromise or issue out of those 11 case reports. And there was 1 report of a ruptured uterus. So it's just important to think about any kind of issue in pregnancy as well, and definitely get them checked out, like send them to the hospital, make sure they get kind of a full workup to make sure everything's going on okay. And then there are some case reports of DIC. Basically, their clotting factors get used up and it leads to massive internal bleeding. So be cautious of any lightning patient, I would say, and definitely recommend that they go to the hospital. Okay, and this is one I really want to stress because it's really quite common, are psychological issues from lightning strikes. People can often have memory issues, concentration issues, issues with cognition or executive function and decision making. And then really, really common are behavioral things. And depression is quite common after a lightning incident. And people can just have PTSD from it, certain phobias from the incident, and just sleep issues as well. So really recommending follow-up for mental health counseling is important after lightning injuries. All right, moving on to treatment. The first thing that I really want to stress is recognize that lightning is a possibility. There have been a lot of incidents where people are just randomly found down in the wilderness or on a golf course around town, and lightning is at play. It can look like so many different things. And looking for those kind of definitive signs like the Lichtenberg flowers, or just clothing being ripped and torn, or shoes being exploded off. Those are some telltale signs, but anyone you find that's down for no good reason, yeah, it could be substance use, it could be another medical condition, but it could also be lightning. So just kind of keep that in your differential, your list of possibilities. It is safe to approach patients as long as they're no longer connected to active electricity or wiring. If someone's been struck by lightning, they no longer hold charge. And that's one myth we'll bust later too, but they are safe to approach. The next one is probably one of the more important things I want you to take away from this talk, which is called reverse triage. So in lightning, we do what's called resuscitate the dead. So, in EMS, we're taught we tag people different colors. In black, we save for later, and we deal with reds and so on and so forth. But you actually want to approach those blacks first. If they're not breathing, consider initiating CPR if they have other signs that are compatible with life. We don't see just crazy trauma, because it could be like we talked about, that their heart was just shocked into abnormal rhythm. What they need is CPR, and they just need their heart to get going again. And they actually have a really good odds of survival. They can survive neurologically intact after cardiac arrest. So lightning patients in cardiac arrest have a good neurological survival. And so we resuscitate the dead. And then other considerations is we just want to consider spinal considerations and spinal precautions. People can often get flung large distances, and consider getting an EKG to see how their heart is affected. And then radiology for any kind of fractures that could be hiding out if they have sustained a large flinging, should I say. And then also, like we stressed, just close follow-up with mental health, because these things can manifest, months or years later, but it is a pretty common find to have someone with a phobia or PTSD or depression afterwards. All right, and as far as prevention, one of the old sayings, and we'll get into a new form of prevention, but one of the old ones, which I think is really a good rule of thumb, is called the 30-30 rule. So if you hear lightning, so from flash to bang, from that lightning flash to the bang of the lightning, if it's 30 seconds or less, it means that lightning's within 6 miles. And that means that you want to go find safety. And we'll talk about what a safe place is in 1 second, but you want to go find safety. And then you want to wait until 30 minutes after that last lightning or thunder before going back outside again and resuming your activities. Important to look at the weather forecast. So if you're going to go to the mountains, see if there's a chance of thunderstorms for that day. And if so, maybe think about adjusting your plan, or trying to be in a safer place. And we'll talk about those. by the time the lightning is forecasted to come. And like we talked about, lightning is most common between noon and 6 p.m. It can definitely happen earlier. And I think that's where your weather forecast is really important. If it looks like a thunderstormy week, maybe just be aware of the fact that thunderstorms could happen in the morning even. Like we had, I think it was about a month ago, right, where we had those AM thunderstorms. Those were so wild. So they can still happen outside that noon to 6 time frame, but keep that as a rule of thumb. And then you always want to be in a safe place. So that brings us to our next topic. What is a safe place? The new saying is, when thunder roars, go indoors. And what is indoors? So a safe place indoors is not necessarily just like a little shack or a tent. What the indoors is a large, substantial, grounded structure, meaning that if lightning strikes outside, it cannot travel inside. And most modern buildings in our society are. One other place that's fully safe is a full metal car. So not a convertible or like a Jeep, with an open top, but a full metal cage car. And that's because it's what is called a Faraday cage. And a Faraday cage, I have pictures coming up in a second, are basically a metal box so that when lightning strikes, the charge follows the path of least resistance down the metal box, around the car, down into the ground. So I used to think, and we'll myth bust this in a second too, that it was the rubber tires that kept us safe on the car. And I extrapolated that to being like, oh yeah, I can totally mountain bike in a storm. I think these rubber tires will totally protect me. But the rubber tires are not what protect us. It's actually the metal cage. So in other places, so those are your two safe places: large, substantial buildings or the Faraday cage of the car. Other places, like let's say you're out in the wilderness on a long backpacking trip and there are no large metal cages. Next, we want to think about very deep caves. So shallow caves, actually lightning can travel in and it'll arc in there, and so you're not safe. But a very deep cave, you could be considered safe from lightning or safe-ish. Deep ravines or thick forests, where basically you have as equal of chance of lightning striking anywhere in that forest. And so you can be like, well, it's better than nothing. Places you do not want to be are open fields, tops of hills or peaks, or shallow caves. Those are places where lightning is more likely. And then I want to touch here, and we'll talk about again, the myth busting is the lightning position. Some of you may have been trained like to get into a crouching position with the idea that when you're lower down and that maybe lightning could just travel through your legs and not through the rest of your body. Studies have shown that, let's say you're in a totally flat field, short grass. If you were to crouch, yes, you might decrease your chances by about 50%, but you are by no means safe in the lightning position. So far better to get to either like a thick forest or a car or indoors when lightning is around. So here's our Faraday cage. This just shows how the electrons can travel outside. A little better depiction here. I like this one. So lightning strikes. It travels the path of least resistance, which is actually around the metal cage and then down to the ground where that positive charge, the negative charges want to get to is. And what's cool is there's these things called the Faraday suits, just to kind of bring the idea home, that people who work on like high electrical wires will actually wear, so that if they get caught in the middle of this charge, it travels outside their suit. All right, and we'll finish up with some myths here. So we just touched on this. That basically the lightning position, if you're in an open field and there's nowhere you can go, yeah, might as well just kind of, I would say psychological help, get in the lightning position. But far better and definitely prioritize getting to either a car and shutting those doors and windows or getting to a substantial building. Lightning is not always fatal. There are a lot of injuries, but it can be very severe. And like we talked about, even if your heart's okay, your lungs and nerves are okay, you can still undergo psychological effects. So it's something we really want to take seriously. It used to be said that lightning can't strike the same place twice, but it definitely can. We've seen lightning strike the Empire State Building, I think over 1 million times at this point. So lightning can strike the same place twice. Lightning can strike in sunny weather. Metal and water do not attract lightning. They actually just help conduct it. So like we showed from the contact burns, if you're in an area and you're hearing that zinging, maybe your hair standing on end, I would get rid of that metal just to avoid getting burned. Let's say you're climbing. If you have metal gear on you, just take it off, set it to the side and kind of get away from it. It's not going to attract it, but you don't want to get burned from it. And with the water, the reason why you don't want to be in the water during a lightning storm is that it conducts it so well that lightning could strike, the opposite side of a large lake. And whereas like if it was just ground, maybe you'd be safe, but you could actually, that current could travel through the water so much farther that you just want to decrease your chances of any kind of contact strike there. And then people are not dangerous to touch if they've been struck by lightning, but just make sure that they're not wrapped up in any other electrical wires. So if they're just on the ground and they've been struck by lightning, it is safe to approach and definitely recommended to approach and start treatment. Lightning does not always strike the highest object. Of course, it does have a preference for it. Rubber tires do not protect us from lightning strikes, unfortunately, for my enjoyment of mountain biking. And then, cell phones also do not attract. That was a rumor for a while, but similar to other metal issues, they just help conduct things. Here's some of my references. Dr. Paul Auerbach's book, the 7th edition of Wilderness Medicine, great in-depth discussion. And then there's also Wilderness EMS book, very good, by Dr. Seth Hawkins. And then the Wilderness Medical Society has great practice guidelines for the prevention and treatment of lightning injuries. And that's all I have. This is a great photo of Salt Lake City from, I think, 2012, and a good storm that rolled over. So right at this point, I'm happy to answer any questions that folks have.
Thank you so much. It's always fun to learn about lightning, and especially the mist, because I think I've been told for years, right, that rubber tires is fine. You'll be able to have that and be good. If anybody's got questions, put them in the chat. Go ahead and come off mute. And just you talked about the common injuries. What is the most common that you have seen or heard of people that are coming into the emergency room for treatment?
Right. Well, I would say more from like what I've seen from the pre-hospital side of things.
Mm-hmm.
Most common are burns, especially that coronal paralysis.
Mm-hmm.
And then I would say also depression and other mental health issues as well, and amnesia. So just totally forgetting what happened. Okay. I heard one provider say, they're like, oh, lightning injuries, they're never quite the same afterwards. And I would say that's a mass generalization. Someone can be totally normal afterwards, but definitely considering the effect that they might be, psychologically affected from that event.
Okay. And with the coronal paralysis, is that something that you need to really think about spinal immobilization for?
No injuries, like no spinal precautions for that.
Yeah.
It's like their nerves just aren't getting the signal from usually their waist down. It can be like higher up as well, but it's usually waist down. They won't be able to move their legs.
Awesome.
Yeah. And I think the big thing just stressing is that if you see someone down from lightning and like the scene is otherwise safe, approach and consider initiating CPR and defibrillation, because the heart can easily get knocked out of whack, just like, getting defibrillated at the wrong time. And so just getting that back and going again is important.
Okay.
Yeah.
We'll open it up. Yeah. Anybody have any questions? Like I said, feel free to come off mute, put it in the chat. Everyone's so quiet today. Is permanent nerve damage common? It's one of the questions.
It's not, permanent nerve damage isn't common, but transient is. So it's more likely that they'll have nerve damage anywhere from a few hours to maybe a few days. But definitely like getting a consult with neurology would be a good idea, especially if they're having lasting effects.
And I'm distracting people a little bit because I just launched my post-presentation poll for them to answer, but.
Oh yeah, no worries. Yeah, and I think interesting just to kind of, fill the time with a little discussion too is there have been some interesting case reports where like, let's see, there's 3 people who went missing in the Sierras. I think it was last summer. And then they eventually found them and they were all just lying down the ground. And one of the ideas was like, well, maybe did they get struck by lightning? And I don't know if they actually ever figured out what happened to this family, but that was one of the top considerations, is like they were all struck by lightning at the same time.
Yeah. Yeah, I know you can talk about this, but I know like Utah is kind of right in that middle thing for not the most lightning strikes, but definitely not the least amount of lightning strikes. So I was looking that up a little bit before turning in all my paperwork on this topic. So
Yeah. And I think one of the things that brings us down here in Utah down from the rankings is that, like, you know, Florida gets these strikes year round because they're warm year round, whereas we don't see strikes in the winter, but we do in the summer. So we have a decent concentration of strikes when we're actually out there up high in mountains, apart from skiing in the winter, of course. But yeah, so we do see a fair number of strikes in the summer for the time that we're out there. Yeah.
Right.
One that was always interesting to me is I was living out in the Tetons in 2010 when there was the big incident on the Grand Teton. So there was 1 dead and 16 injured. Lightning came around noon that day and just struck everybody down who was in that vicinity near the summit at that time. So that was a pretty big incident. And then they had to figure out how to get all 16 people who, like, most of them weren't able to move off the mountain. So it's a pretty big operation. Yeah.
Yeah, I can imagine. It's not always fun, that search and rescue, getting folks down off the mountain, especially not in the Tetons. And everybody's got to think about the fact that Utah, we don't usually hoist people. So
yeah.